As the world marks World Haemophilia Day, the Kenya Haemophilia Association is advocating for a multi-pronged approach in tackling the rare disease. The association officials say despite the growing number of diagnosed cases, hemophilia is a genetic bleeding disorder, remains widely unprioritized with limited access to life-saving medication and specialized treatment centers. They are urging the government to increase the budgetary allocation towards hemophilia care, highlighting also that the high cost of clotting factor medication has made it inaccessible for most patients, particularly those from low-income families.
As the world marks World Haemophilia Day with the theme of this year being access for all, women and girls bleed too. People living with the disease in the country continue to face a silent crisis. The genetic bleeding disorder remains widely misunderstood and underprioritized.
This condition has been associated with complications at childbirth. We hear about maternal death because of blood loss. This is one reason that contributes to blood loss. And we would wish that all of us, jointly together, started talking about this disorder and confront it as a nation.
With limited access to life-saving medication and specialized treatment centers, many patients are left to suffer in silence.
When my teeth were removed, because it is a culture that we remove our lower teeth as Maasais, I lost my blood to almost death.
Miguu sasa imekuwa challenging sana. Unapata bleeds kwa miguu. Na ina cause disability because as you can see nikiwalk, mimi siwezi tembea vile inavyofaa.
According to the Kenya Haemophilia Association, despite the improved treatment options, those with bleeding disorders in the country still lack adequate care.
We must allocate sustainable funding for consistent national supply of clotting factor. Clotting factor is the only medicine given to a person who has a bleeding hemophilia, bleeding disorder.
We are losing lives from a killer whom we know. A killer that the ordinary Kenyans cannot afford to prevent. It's only the government resources that can be able to save Kenyans. A dose costs 50,000 Kenya shillings. And for the minimum, you require 3 doses. That translates to 150,000 Kenya shillings.
The stakeholders have cited the exclusion of hemophilia from Social Health Insurance Fund and lack of funding, leaving patients and their families vulnerable to the high financial burden of treatment.
Hemophilia is not covered by the Social Health Insurance Fund. The government does not procure or fund treatment products. No clotting factor concentrates are registered with the Pharmacy and Poisons Board. Private hospitals lack stock due to high cost and low awareness.
As the number of preventable deaths grows, the Kenya Haemophilia Association is now sounding the alarm, calling on the government to take immediate and decisive action. Martini Maslin for Prime Edition.